Hi everyone. Our minds are without a doubt humankind's most useful tool. It plays a part in our triumphs and helps us recover from our losses. That being said, can you imagine if this part of us became ill? This happens to many of us through mental health disorders. For this speech, I'll be talking about the role mental health plays in our lives, my journey with mental health, how the recent pandemic is affecting mental health, and lastly, things that can help mental health. The information in this speech is valuable to those looking for a broader picture of mental health and why it is an important part of our lives. I personally have experience with mental health as well as having close friends with their own mental health, and my career mission is to become a psychotherapist and treat people with mental illnesses. The main points of this speech covers the role mental health plays in our lives, my own journey with it, how the pandemic is affecting it, and things we can do to help mental health. To start off with, I'll be discussing the critical role mental health plays in our lives, and what could happen through the possible diagnoses of mental illness. Imagine trying to carry out basic daily functions and being interrupted by yourself. Imagine being intruded upon by your own mind while trying to drive to work, cook breakfast, or brush your teeth. It is true that this can happen with basic negative thoughts, but what makes a mental health disorder is consistency. People with OCD face so many hurdles throughout the day by things that other people can do without a second thought, such as locking the door when they leave the house, making sure the headlights are off when getting out of their car, and clocking in at work. While people with depression can face many intrusive negative thoughts about themselves interrupting their daily life. These things considered, it is important to advocate and support people to have better mental health in their lives. Even with the absence of a diagnosis, people need to be supported mentally to prevent diagnoses like depression and anxiety. Because these diagnoses do not happen overnight, it comes to repeated negative exposure from life, and others need to be more aware and considerate of it. And there are still staggering statistics revolving around how many people have mental illnesses. According to the National Institute of Mental Health, about one out of five people in the US have a mental illness, which is why acceptance is very important. It is very common for people to hide mental illnesses for the sake of not being judged negatively or not being accepted, which can make people feel worse about it and refuse to seek help from their family, friends, or medical professionals. According to highwayrecovery.org, between 80 and 30% of others don't look for help with their mental illness. Next, I'll be speaking about my own journey with mental health and the outlook it has given me, and what my own struggles with mental health have been. I come from an emotionally abusive home and was faced with constant fear. This is probably where my mental illness is spawned from. Eventually, they developed into anxiety, depression, and PTSD. And even once I got older and left my childhood home, I still carried these things with me. People can carry mental illnesses for a lifetime, which is why I believe early intervention is so important. And this is what I have done despite these ailments. Despite struggling with these problems, I have succeeded in the jobs that I've worked at, the education I've pursued, and the friends that I've made. I'm even on track now to receive a valedictorian award from the Stone Mountain campus when I graduate soon, which I am super proud of. I hope I can attend the graduation. Lastly, how I try to look at my history of mental health. This is how I try to. For years now, I've had the ambition to become a psychotherapist. My goal is to work as a social worker after getting my bachelor's and then go back for my master's to become a psychotherapist. These kinds of goals make me value the negative experiences I've had and the illnesses that I still carry with me because it has provided me with a lot of empathy, insight, and experience. My goal is to treat clients who have mental illnesses such as depression and PTSD and show them they can still recover and succeed despite it. I haven't yet decided what diagnoses I would want to specialize in. I would imagine that would come later with more academic and real, like actual experience, life experience. As the pandemic groups further into our nation, it is important to take a look at how it is affecting our mental health, because mental health has taken a stark decline since the pandemic started. People in the pandemic are being encouraged to stay at home and limit contact with others. My grandmother hasn't left her house in 6 months. It is a serious condition in someone's mental state to stay at home for a long period of time. It can become very negative. There is also the case of paranoia when someone ventures out to go and get food and necessities. And media during the pandemic has been very damaging to mental health as well. During the course of the pandemic, the media has been reporting on COVID almost nonstop. On CNN, there was always a death toll as well as a case count. What's worse is there's no foolproof way to avoid catching the virus. It is strongly advised to wear masks, but this only decreases your chance of getting the virus, which can make you feel paranoid, scared, and already defeated. According to the University of California, Davis, masks are only 65% effective. The only way to completely ensure someone's safety is to self-quarantine completely by themselves or with family, and to receive their groceries and necessities through delivery. Not only is this not feasible for many, but it is extremely detrimental to mental health to attempt to do something like this. What's worse is there is no end date to the pandemic. People are struggling to live in the pandemic, and they're also faced with the stark fact of not having an end date to where things will go back to normal. For example, I worked at a movie theater when COVID hit, and when it did, every single theater shut down, and the theater hasn't opened that I worked at hasn't opened since. I can't help but think of the mental state of the managers and the owners of the theater. And this is how Thanksgiving is being recommended. According to Today.com, experts are recommending for families to quarantine for 2 weeks just to be able to attend Thanksgiving dinner safely. Not only is this very hard for people to do, but it's not possible for many. A lot of people have to leave the house to work. Lastly, these are some things that can help with mental health. The first step in treating a mental health disorder is recognizing it. Visiting a psychiatrist can diagnose someone with mental illnesses such as depression and anxiety. There are also options to get psychologically evaluated, which is vitally important mental health disorders such as schizophrenia and psychosis, because these two illnesses, for example, have similar symptoms and similar treatments, but the way that they treat the illness in the long term is decided upon the diagnosis of the disorder. So it is very important in these kinds of cases to get psychologically evaluated. And next, medicine should be considered as well. Obtaining the right kind of medication from a psychiatrist can be difficult. A lot of people have negative reactions to medications, but through trial and error, finding the right medication is worth it in the end. Another thing that can help are support systems. Having close and positive relationships in someone's life is very important, which is why it is crucial to have a support system. It is nearly impossible to recover from things like these kinds of things on your own. Everyone needs people who understand and supports them. Therapy can also help. Certain psychotherapists are trained in specific mental health disorders. With research and background on finding one, it can really help someone going through a mental health disorder, especially if they haven't already been seen by one. Therapists can recommend great and relevant self-help books as well as assignments to take home with. A therapist can also give someone an unbiased perspective of someone to talk to. Very often, people don't share too much with their friends or families because of how they're afraid of how they would perceive it and how they would perceive them after sharing this information. which is why visiting a therapist can be very useful to speak about these kinds of things. Lastly, something that could help if it is warranted is a psychiatric hospital. If someone is becoming unstable with mental health disorders or even considering suicide, a psychiatric hospital is one of the best options to take. They house people overnight and integrate them to other patients and receive daily group workshops on mental health. After covering these important topics, this drives me to my conclusion. Throughout this speech, I've covered the role mental health has played in our lives, my journey with mental health, how the recent pandemic is affecting our mental health, as well as things we can do to aid mental health. After this speech, I hope you all have a better understanding of mental health and the things that can affect it, because maintaining a healthy mind is crucial to our lives. All right, thank you so much.